Hi, my name is Melissa Schellenberger. I am a nurse practitioner at the MS Center at Norton Neuroscience Institute. I'm going to be talking about integrative medicine today, specifically therapies that are used in multiple sclerosis. So there are a variety of terms and names that people have heard to describe what is currently called integrative medicine or integrative healthcare. The most recent kind of nomenclature prior to this was called CAM therapy, or complementary and alternative medicine. You've heard of holistic medicine, homeopathic. Dr. Alan Bowling refers to this as unconventional medicine. We'll talk about him shortly. And then the newer terminology that's coming out will be mind, body, health, and healing. This is kind of will be more of a universal term coming in the future. I just completed my mind, body, health, and healing certification through Mass General Hospital. So that's kind of the newest terminology. Encompasses more, I believe. So we'll talk about Dr. Alan Bowling. He's a neurologist and an MS specialist. He's also an integrative medicine expert and known in the United States and other countries as kind of the guru for MS and integrative therapy, integrative medicine. So many of you have probably heard of him. He's several books. He's used to travel and speak quite a bit. And I'll be referring to one of his recent articles pretty significantly through the discussion. If you'd like more information, these are some good guidelines or good websites to keep in mind and make a note of. The National Center for Complementary and Integrative Health. So this is a national, this is a U.S. government website that will update and keep you kind of on top of things if this is an area that you're interested in. And then National Center for Biotechnology Information has a lot of research, up-and-coming research, very good site for people who are really interested in the data that's going on and specific studies with these therapies and MS patients and variety of neurology patients, actually. NationalMSSociety.org is something that you should probably look at pretty regularly if you have an interest in MS, and the AAN will cover just about anything you need to know and send you to other appropriate sites. So what is integrative medicine? Integrative medicine, and this definition is taken from Dr. Alan Bowling, use of evidence-based, conventional, so evidence-based, research-based, conventional, lifestyle, and what he terms unconventional medicine. Just kind of make it simple. Focus on health and wellness of the whole person. So it's that holistic piece. This is a really a key piece of integrative medicine that you'll find if you look into the research or any of the books that are out. One of the key pieces is a supportive clinician-patient relationship, so that there is that core foundation of trust and support, taking care of the whole person at the same time. The goal is to treat and manage disease while maintaining the health of the whole person. So yes, we focus on disease, but also we focus on health. So Dr. Bowling he focuses on, let's look at what we do day to day. What are our lifestyle practices like? Sleep, I feel like, is huge, and so I focus quite a bit on sleep in my practice because it affects so much of our brain function, our body. We'll talk about that. Nutrition, exercise, mental health, and use of alcohol and tobacco. So if you will read his most recent books, the article that I'm going to refer to, these are his key points where we need to intervene. As a patient, where you need to be focused on, and as a clinician, these are the areas we need to look at with MS patients. So lifestyle practices and changes in your lifestyle have the potential for modifying disease. managing symptoms of MS, improving your general health, and preventing relapses, comorbidities, things like that. So here's a short list of integrative therapies that I've taken from Dr. Bowling's most recent book, which is called Optimal Health in MS. And this is a large volume book. This is just a brief, list of the many things that you'd be surprised at how many different therapies, integrative medicine therapies that he has looked into, researched, and he will provide you quite a bit of information on each one so that you can, kind of decide for yourself. So acupuncture, massage, aromatherapy, meditation, actually quite a bit of research about the benefits of meditation with MS and mindfulness specifically with MS, yoga as well, reflexology, herbs, Ayurveda, biofeedback, chiropractic medicine, and the benefits of being in nature have actually shown to help the neural connections, decrease stress. I mean, there's just so many different things. That's a completely separate talk and pretty fascinating, the research behind it and the research that's being done about exposure to nature and health benefits. So I'll just take a minute to say that the Norton Neuroscience Resource Center actually offers quite a few of these therapies already. So even this is more of an up and coming area of study, especially in 2020, 2021. Our resource center is already offering several of these very good classes, and currently they're virtual, so you don't even have to get out. You can do that from your home, and I know patients are really, really enjoying the virtual forms as well. So massage, of course, one of my favorites. I don't know who wouldn't want to participate in this therapy, especially if you know this could benefit your health in many ways. Sleep, one of my number one points of emphasis with patients. So key to a healthy life. So this, I'm going to kind of turn now to a 2018 article from Dr. Bowling called Integrative Care for Patients with Multiple Sclerosis. So the next several slides are coming directly from this article, and it's listed in my references. So this is very up to date from him. So here's the gist of his integrative care in 7 steps for MS. Number 1, disease-modifying medication. This is not to be overlooked. As we all know, very important that you speak with your MS specialist regarding being on a disease-modifying medications or a DMT in order to keep your MS under control and, keep a lid on it, essentially. So this is not to be overlooked. This is step number 1 in integrative care. Step 2, symptom management using integrative therapies, physical activity or exercise, nutrition, weight management, maintaining a healthy weight, of course, personal and social well-being, which is also mental health. Again, tobacco and alcohol use are key, and then preventing and managing comorbidities. Okay, so talking about symptom management, we know about our conventional therapies. So we use medications to help with symptoms of issues associated with MS. We send you to therapy. We use a lot of physical therapy, occupational therapy, speech therapy, water therapy, of course, and we order assistive devices to help. So these are things that we already know about. Lifestyle changes. This is the big piece that we're talking about, 2020, 2021. Specifically physical activity, but also mind-body strategies that can help with a variety of MS symptoms. So there are actually a wide range of clinical trials that support the therapies that we're going to talk about now, Table 1 and Table 2. Again, this is all from Dr. Bowling's recent article. So you can glance through this. Common MS symptoms that can be possibly improved with some unconventional therapies or holistic therapies, integrative therapies. So you can glance through there. And again, several of these therapies are offered through our resource center, as well as in the community. And there is research to back the majority of these therapies. So this is our second table, which is similar. It breaks it down a little bit differently, but if you can see that, look at anxiety. If you look at that's across the board, exercise, Tai Chi, yoga, guided imagery, meditation, mindfulness. Again, there's quite a bit of research to support this. Same as depression, across the board, therapies that can help with depression. Fatigue, as we know, number one complaint, number one complaint in the office for sure, but it's a big time symptom with MS. Gait dysfunction, pain, sleep problems. So you can see how beneficial some of these can be with the big symptoms that we try to manage and work through on a daily basis with MS patients. So physical activity, multiple potential benefits for physical activity, and there are going to be, if there haven't been already, there are going to be other talks specifically about physical activity and getting moving. So as we've seen in our charts, being active, it's not necessarily boot camp. It's taking a walk, getting outside in nature, of course, water therapy, yoga, so many different options can help with anxiety, depression, cognitive changes, fatigue, pain, sleep. I mean, all of the things that we deal with, regularly, consistently with our patients. Bowel and bladder function, mobility, spasticity, weakness. In addition, we can decrease the chance of relapse and disability progression, which is really the whole point of seeing someone for your MS. That's the point right there. Also, physical activity is helpful in preventing comorbidities. This is a big piece. Patients with MS have similar health issues to the general population: heart disease, stroke, high blood pressure, high cholesterol, issues with overweight, diabetes, osteoporosis, cancer. Physical activity, exercise, keeping moving can help prevent these. And if you have them already, help to treat and keep things in a good range. So sort of already mentioned this, but Tai Chi, yoga, Pilates, hydrotherapy, water aerobics, swimming, water walking, so beneficial for the body and the mind. So also we do this quite a bit, or I do, refer patients to physical therapy. You know, we are fortunate to have really good physical therapists with Norton, MS specialized physical therapists. They do a wonderful job with our patients. And so they can meet with you and come up with a specialized program that you can then do at home. And it doesn't have to be at a gym with heavy weights or, like I said, boot camp or any of this kind of stuff. But the key is having some aerobic activity along with muscle strengthening. So combining those two. So walking is important, but also getting those muscles, getting good muscle tone. So again, you don't have to have weights, bands, different things like that, PT uses this quite a bit. But the number one point really though is consistency. Keep moving. Use or lose it is what a lot of patients tell me. So yeah, keeping going, keeping active, very important. Water therapy, once again, you cannot go wrong with a swim, with a water walk, especially on a nice day. Okay, so nutrition and healthy weight is another one of the points of Dr. McDonald's, of Dr. Bowling's article. And so people familiar with MS, patients with MS, have heard there are a lot of there's a lot of discussion about, what's the right diet. I get asked a lot of times, keto, should I do keto? Isn't that the best diet? So there's a lot of research out there on a variety of diets, a lot of reading to be done on that. But Dr. Bowling recommends what he's calling a generally healthy diet. So what he means by that is following USDA dietary guidelines. So the new guidelines come out in 2020. So currently we have the 2015 guidelines, but at some point 2020 guidelines will be coming out. But basically it's a heart healthy diet. It's like, let's, take care of our whole body. This is the best diet for MS patients, or the best meal plan to follow. So really primarily plant-based. Mediterranean fits into that dash, which is the heart healthy. McDougall is similar, vegetarian. You Can't go wrong with vegetarian diet for most of us. And so really just lean meats, fiber, whole foods, real foods, fruits and vegetables. This should be the plan for MS patients in general. Again, there's a lot of reading to be done on this. We get asked about supplements a lot, and Dr. Bowling is pretty clear about the importance of vitamin D and B12, which you're probably speaking regularly with your MS provider about these. We check these levels regularly and make recommendations. At this time, you know, the recommendation from Dr. Bowling, kind of our MS guru, is to pretty much avoid the majority of other supplements. There are hundreds, I mean, at least 200 supplements that could possibly be detrimental with MS. So the key, I guess, is to, you know, speak with your physician before starting any supplement, except vitamin D and B12, which should also already be a topic of conversation. Maintaining a healthy weight, very important in managing really any disease, but definitely with MS, can worsen symptoms and, you know, overall disease course if we're dealing with, you know, health issues related to obesity. Real food is the key. Healthy fruits and vegetables. I know it's hard, but you really can't go wrong with eating real food and not things that are processed and sold at a drive-through, you know, most things like this. Okay, emotional well-being. This is key. I know I do talk a lot about sleep, but mental health is really something that we address in most of our meetings. And I think Norton is really in process of coming up with a good plan for having providers available to our patients. Mental health is really hand in hand. Well, obviously for all of us, mental health is important for our health, but MS patients, you know, are susceptible to depression, anxiety, variety of things that we really need to address. So the most common comorbid health issues with MS are mental health issues. Now, this is huge. So this is from Dr. Bowling's recent article. He's quoting rates of 50% of MS patients have depression and 36% have anxiety. This is reported from patients. I believe these numbers are higher, and I feel like this is something that should be discussed at every visit. So whether you're a provider or a patient, I think this is something to keep in mind. Like, let's talk about this. Let's get a plan. There's a lot going on in the world, and so people that don't have MS are struggling with managing the difficulties of life right now. So our MS patients need to be tuned into this. We need to be tuned into our patients. So high levels of stress can increase the risk of relapse, which MS patients know, they're very aware, and can worsen symptoms. So disability progression has also been associated with these psychiatric comorbidities. Again, we'll go back to physical activity. One of the best non-pharmacological treatments, where's our little swimmer guy? For MS, or for mental health, for managing mental health, exercise, staying active, really can help you with depression, anxiety, mood changes, irritability, so many things. All right. So we'll talk quickly about some lifestyle modifications and therapies that can help mental health. Again, there's a lot of research on this, so you can glance through. I mean, these are huge lists. Things that can help anxiety and depression, your mood, we know. And again, can help with a variety of MS symptoms. So this is a great list. Okay, tobacco use. Tobacco use is very common in the state of Kentucky. Lung cancer is the #1 cause of cancer death in Kentucky. So we're all very aware of, you know, how frequently healthcare providers are dealing with smokers and the disease process that comes with that. So specifically with MS patients, tobacco use is associated with increased risk of relapse, lesion development on MRI, converting from relapsing, remitting MS to a secondary progressive disease and disability progression. There's an increased risk for development of neutralizing antibodies for natalizumab or Tysabri and interferons. Smoking-induced comorbidities, as we know, cancer, coronary artery disease, stroke, pneumonia, asthma, COPD, osteoporosis. If you have MS, you're dealing with a lot of things already. We do not want you to have cancer. We do not want you to have emphysema. We don't want you to have to deal with a lot of the comorbidities that come with smoking. So again, this is another topic that really should be discussed on a regular basis with your MS provider, MS specialist, because we can help you with this. Alcohol use. Clearly, we all know that drinking alcohol can cause decrease in a level of alertness and cognitive function, poor coordination, gait dysfunction, falls and injuries. This is something we work on preventing day in and day out with our patients. Like, let's get into physical therapy. Let's get you, a rollator. Let's see what we can do. So we can't add alcohol into this mix. Very dangerous. Worsens fatigue, increased reaction times. Just nothing good about this, Again, comorbidities. Increased risk for comorbidities, again, cancers, multiple cancers, liver disease, hypertension, malnutrition, everything in moderation, is what they say, but really alcohol really has no benefit with neurological disorders. I'll leave that there. Okay. So prevention of comorbidities, we've talked about this in and out during this talk. We've come into it and come out of it. So obviously we have to be aware of comorbidities, but MS is typically, not always, as we know, diagnosed between the ages of 20 and 40. So during this time, the majority of people do not have a lot of comorbidities. So you're diagnosed with MS in these early years. Let's keep you from, adding anything else. Let's try to be as healthy as possible and just focus on, keeping MS solid, keeping things at bay, while keeping the rest of our mind and body as healthy as possible. Then we don't have to worry about drug interactions, with your diabetes medicine, with your blood pressure medicine, surgeries, things like that are just going to benefit you in the long run. And let you just focus on what you need to do for your MS and not necessarily worrying about so many other things. Again, prevention of comorbidities, lifestyle modifications, as we've gone through this whole talk. Treatment of comorbidities. So if you already have something going on, which a lot of people do, we really have to optimize this treatment. So we can't just say, we're going to talk about your MS today, and I have no interest in these other medications or what's going on. We've got to make sure that things stay in order, and that we stay on top of diabetes, weight, high blood pressure, high cholesterol. Very important. Okay, so that is it for me, actually. A little peek into integrative medicine. Once again, Dr. Alan Bowling is well known for his work in integrative medicine and MS. So you can see in the references, I've got him in here. You can Google him, of course. A lot of good information, especially that most recent article just really lays it out, that 2018 article. So thanks for listening, and take care.